Hi, internal urinary devices. Last week we covered external urinary devices. This week I'm going to go over internal urinary devices. These are flexible tubes that are inserted into the bladder to drain urine passively. There are two types, the suprapubic catheters and the urethral catheters. The suprapubic catheter, just as the name implies, is inserted above the pubis directly into the bladder to drain urine. While the urethral catheters are four types, there's the intermittent catheter, or it's also called the straight cath or straight catheter. And then there is the two-way catheter, commonly called the Foley catheter, and is the most common of all these catheters. And then there's a three-way catheter, and then there's the Coude catheter. Now, the intermittent catheter, just as the name implies, is used intermittently. That is, it is not indwelling. You don't put it in and leave it there. When you put it in and leave it there, it becomes an indwelling catheter. But this one is intermittent. You insert it, drain the urine, and remove it immediately. The idea of doing that is to reduce the likelihood of COTSI, that's catheter-related UTI. So with that, if you put it and remove it, maybe sometimes it's Q4 or Q6, depending on what the order is. It is believed that the risk of infection is less with that. Now, the two-way catheter, which is the Foley catheter, it's an indwelling catheter. So you put it in, leave it in, and attach it to a drainage bag, which could be a leg bag, which is smaller, or a bigger bag. So that's it with the Foley catheter. Then the three-way catheter has three ports. The Foley catheter has two ports. That's the port that drains the urine, and the balloon port, where you inject the sterile water to anchor the balloon in the bladder. The three-way catheter has three ports: the drainage port, the balloon port, and the irrigation port. So it is used for irrigation of the bladder. Now, the fourth one, which is the Coude catheter. The Coude catheter is a special catheter that has a curved tip that is used to catheterize patients that have obstruction due to enlarged prostate. So because the tip is curved, it is able to navigate its way through the obstruction that is caused by the prostate gland and then into the bladder. So that is pretty much it with the internal urinary devices. Then I want to point out a few things about these devices. The sterile water that you inject into the balloon is usually 10 ml, but look at the label. Each catheter has a recommended number of mLs that you should use to inflate the balloon, and that recommended number is written on the balloon port, where it states the size of the catheter. If it's a 16 French, 14 French, it will state it on that balloon port. And then it will also, below it will say either 10 mLs or 15 mLs or whatever mLs that is recommended by the manufacturer. So when you are inserting the catheters, make sure you check how many mLs that is recommended to push into the balloon to anchor it anchor it in the bladder. Another place where you will see that is on the pack of the catheter. You see that they write the size, and then below the size they write either 10 mLs or 15 mLs. So be sure to take a look at that. Then another thing I want to bring up is getting urine samples from these catheters. So the catheters have urine sample pots. That's, they have pots where you can get urine from to take a sterile sample of urine. There are two types of pots. There's one that is needleless and there's one that you can use a needle. The one that is needleless, you can screw on a syringe and withdraw, aspirate the urine after you finish scrubbing the, the pots. You have to maintain sterility, of course. Then the one that has a needle, it has a self-sealing material that even when you puncture it with a needle, it does not leak. So you see that on the image. Then another thing, apart from the syringe, the best way to get sample from it is using a vacutainer. The same kind of vacutainer that is used to withdraw blood, and it looks like this. This tip will not match with the catheter port, but there is one that will match with it. It has a lower lock. There's something called a lower lock that you can use this thing. You see, there is a needle inside of it. You screw this on the port, and then you take the lab tube, that's the lab specimen tube, and put it here, press it into the needle that is here, and then it will suck up the urine. So once you do that, that one is just straight, just one and done. You don't need to move it from the syringe to a cup, from the cup to the specimen bottles. When you use these vacutainers, you just get the urine straight into the bottle, which is the best way to get it out, rather than using either the syringe to suck it or using the needle with the syringe, to aspirate. So I think I have covered pretty much everything about it. Thank you for listening. Make sure to like, share, subscribe, and follow for more.